Afternoon, everybody, and welcome to our webinar today. We're going to be talking about satisfying the new AB2246 suicide prevention legislation and a turnkey professional development solution you might want to consider from Kognito. We're also going to hear from Brenda Carrillo of Palo Alto Unified School District about the work that her district has been doing in suicide prevention. They are really experts at this, and she'll share a little bit about the work they're doing and about the work they're doing with us here at Kognito. We have people who are continuing to sign on, so we'll do a little housekeeping before we start. And I'll just say I am Jennifer Spiegler. I'm the Senior Vice President of Strategic Partnerships here at Kognito. I do a lot of work with our statewide and large district clients, working with my team is working with Brenda and her team out there in California. I want to talk a little bit about the housekeeping piece. So the presentation will be recorded, and a copy of the recording and the slides will be sent out after the presentation, probably this afternoon or tomorrow. You as attendees are in listen-only mode, which means you can't talk to us, but you can submit your questions by using the dialog box on the right-hand side of your screen. And if you want to practice asking questions and get comfortable with that, answer a question for me, which is, are you in the beginning of suicide prevention efforts, in the middle, or pretty advanced in your district or school? So let me know that you're out there, where you're from, and whether you're beginning, middle, or advanced in your suicide prevention methods in the run-up to this AB 2246 mandate. And thank you all for taking the time to be with us today. This is an extremely important topic, of course, and we're really, really happy to welcome Brenda. And Brenda, why don't you say a little bit about the work that you do out in Palo Alto?
Sure. Thank you, Jennifer, and welcome to everyone who's on the webinar. My name is Brenda Carrillo, and I'm the Director of Wellness and Support Services here in Palo Alto Unified, which is in Silicon Valley, California. And my role is essentially to work with all of our schools. We have 17 schools in our school district to about 12,000 students to promote the idea of resiliency, suicide prevention and awareness, and provide our schools with resources to be able to support all students to achieve at high levels. So that's just a little bit about the work that I do here.
Great. And then let's flip to our agenda and talk about what we will talk about. It's pretty constrained, but we have a lot to say. So first we'll talk a little bit about the new legislation, what we know from looking at it and what we've heard. Brenda will then talk about the work she's doing at Palo Alto and some suicide prevention best practices. I will do a little talking about Kognito simulations and the whys, wherefores, and I'll do a quick demo of one of those simulations live. Brenda will talk about some of the early data coming out of Palo Alto from using our simulations, and then we'll take questions. So feel free to ask questions as we go along, as things come up, and we'll circle back to those questions that haven't been answered. So let's start with AB 2246, which was signed into law by Governor Brown on September 26th. And this is legislation that requires local education agencies, starting with the 2017 school year, to adopt a policy on pupil suicide in secondary school, middle and high school, grades 7 to 12. And that policy has to address procedures relating to suicide prevention, intervention, and postvention. What we do know, as well as reading the legislation, is that a model policy is currently being developed by CDE, and we hope to be able to see that in January. So you're not just hanging out there having to make this stuff up on your own. There are other model policies out there. The Trevor Project and the American Foundation for Suicide Prevention have a model policy, I think in conjunction with NASP, the National Association of School Psychologists, that they've developed. And Palo Alto, and you'll see this at the end of our slides, has its own suicide prevention policies that you can learn from and use parts and pieces of. So, you know, it's not as restrictive as some states. Some states we've seen have precise parameters for example, teacher training. You have to have 2 hours every year, or 1 hour every year, or 4 hours every 5 years. It gets confusing, but they've left you a lot of leeway, in fact, to adopt policies and procedures that suit your location. And our hope, having been working in this area for the past 7 years, is that you will really take this opportunity to do something very meaningful with this mandate. And now I think I'd like to go ahead and turn it back to you, Brenda, and you can talk a little bit about Palo Alto and how you came to be experts in this area.
Thank you, Jennifer. I really appreciate the acknowledgement of the incredible work that we have done in our district around suicide prevention, intervention, and postvention, although I would say that we're still learning all of the time. And so while I do think we have some expertise, we see this as a journey in which we're always looking to get better. So as I talk about our efforts, I'll also mention some of the work that we're continuing to do as best practices continue to emerge. So I do appreciate the opportunity to share our work in the area of suicide prevention within the context of AB2246, and in a little bit I'll also have the opportunity to share about Kognito specifically. But I think it's important to mention that as a district and as a community, we've been focused on raising awareness and skill and knowledge in the area of suicide prevention in our school communities for quite some time. This really comes from the fact that we have experienced several clusters in which we lost current students or students that have recently graduated from Palo Alto Unified. For those of you who may not be as familiar with Palo Alto as others, we're an extremely high-performing school district, a fairly resourced school district located in the Silicon Valley, right across from the Stanford campus. And so we know that many of our parents in this community are highly educated and have very high expectations for the students, and students themselves have high expectations in terms of their outcomes. And so we do know that there's quite a bit of stress and pressure that exists in our community. So we've been paying attention to issues of mental health, paying attention to issues of stress and anxiety, and of well-being in our district for some time. I mentioned that we had several suicides that occurred. Our first cluster of suicides occurred in 2009, 2010, and at that point we lost 5 students that were either recent students or recent graduates, or excuse me, current students or recent graduates. And then in 2014, in October through March of 2015, we lost 4 additional students to suicide, one of which was a recent graduate. Most of our students that have died by suicide in our community have been high school students, and most of those deaths have been by train. And you know, unfortunately, we have a train that runs right through the middle of our town. So the issue of means is one that we're constantly trying to be creative around restricting. So as a result of the losses that we experienced, we really mobilized, not only as a school district, but really as a community, to work collaboratively and come together as partners to address the issues of mental health and suicide prevention. We've focused our efforts on policies as well as practices and programming to help really to build these learning spaces where our teachers, our administrators, our parents, and students can have some real foundational skills in supporting students that are at risk for suicide. And I think one of the things that we've been focusing on much more recently, is the idea, because we're a unified school district, of starting earlier. Although our tragedies have happened mostly at the high school level, we did have one student who died by suicide, who was a middle school student, who would have been a high school student in transition. But we know that these issues of mental health really emerged in elementary school and earlier on in life. And so we're really excited about Kognito as a tool that helps us to build awareness K-12. So what I would share is that our suicide prevention policy has been in place now for since 2010. It was a strategic approach that we took to addressing suicide efforts, and it really is a foundational component of our work. We're waiting for the CDE to release the model policy that I believe is going to be coming out in January, but also are doing some of our internal work to include memorialization and anniversaries as part of our policy, because we've lost so many students. These issues are really salient for us, and so that's something that we are working on now. We do have a community approach to our efforts. We partner with over 40 other different community agencies and organizations in Palo Alto to create a safety net for our students, because we know that schools on their own are not going to be successful in addressing some of these issues. So in terms of our conceptual framework here that is on the slide, you know, our perspective on serving school communities really starts with the idea that student, staff, parents, and families are at the center of our efforts. And so our suicide prevention activities are therefore focused on the idea of how to best support all of our stakeholders and our school communities as a whole. What we know is that parents and students are our partners in this work. We see in the second ring, our school districts, our school sites and administrators, and our community as playing a central role again in these efforts. For example, some of you might know that recently the school district, along with Project Safety Net, which is our community collaborative around suicide prevention, we came together with the Santa Clara County Public Health Department and had the Center for Disease Control invited them to come to Palo Alto to help us to understand what might we be missing, given that we've had the second cluster of suicides. You know, are there things that we need to be thinking about differently? Is there work that we need to be deepening to really support all of our students? We have received a preliminary report and are waiting for a final report that will probably come out in early spring. So the partnership piece is central to our work. And we also, I would say about our framework, you know, prevention, intervention, and postvention, we see those as all very interrelated. And so that's part of the work that we're doing, is to make sure we're addressing all elements. The next slide here talks about our approach to prevention work. We see this as really tiered. We know that all students need some level of support, and so these are some examples of the different programs that we have available. Kognito, you'll see, is one of those that's indicated here at the bottom tier as something that we think serves all students. If all of our teachers and all of our classified are trained, and administrators are trained in how to recognize issues of distress, we think that will serve all of our students to be in a safe and more welcoming and aware space. And then, of course, we have our Tier 2 and our Tier 3 interventions. So it is a continuum of services that we have in place, and how we like to think about how to best support all of our students in this work. So I don't know if you want me to add anything more, Jennifer, about this.
I would say it would be great for you to come back and do an entire hour for this audience, and we'll do that maybe after the CDE comes out with its policy, because that would be great. This is a good moment, I think, to transition to talking about just what the Kognito simulations are, and what we hope people can gain from thinking about these. So thank you, and that was really beautifully presented, I have to say. It's always really hard to hear about communities that have suffered such tragedies, but also so much hope in the changes that are brought about and the ways that communities come together to heal. And I know that you're really at the center of a lot of that. So thanks for for sharing that. So a little bit about Kognito. We are a health simulation company. We're based in New York City, but we operate all over the country. And we have a core belief in the power of conversation to inspire and inform, impact how people think and act, evoke empathy, and change lives. And it's somehow not intuitive that you would pursue that belief in the power of conversation through a technology like the one that we have, like the platform that we've developed, but there you are. And somehow it's not surprising that one of the first adopters of this program in California has been in Palo Alto, in the heart of Silicon Valley, but we definitely have users all over the country, some in very, very rural areas and some in very urban areas. But we're bringing together that notion of conversation with preparing people to have those conversations effectively. We have been pioneers in this area for about 8 years. The company itself is about 13 years old, but turned its attention solely to health simulations in about 2008, where we bring role play to prepare individuals to lead real life conversations. So bringing the virtual world together with real life and teaching you how to do something in a safe space that you would do hopefully very effectively in your real life. And you can see along the bottom just a few of the clients and partners that we have. We're working, and I think what it speaks to really is how this approach is different and resonates with so many different organizations, both in academia and foundations and government agencies, people who are doing public health. This approach has really been a revelation for. So what makes this unique? Virtual role plays with emotionally responsive virtual students and real-time performance feedback are engaging, relevant, and realistic. These are programs that, even though they're online, engage you like a very engaging workshop in real life. We have been able, through our research, to prove that they actually build sustained skills and self-confidence. Those are predictive of behavior change, but we also, because we've been able to train hundreds of thousands of teachers over the past few years, demonstrated actual behavior change. We know that these simulations increase the number of students that are identified, approached, and referred for mental health services. We've also tried to lower the bar for the implementer, be that the school district or the state agency who's doing the implementation. We make them as easy as possible to deploy and to track. So you can, as a district, and if you're at the district level, you'll appreciate this, you can look across your different schools to look at usage. Brenda and I were talking earlier about the successes that she's had with her elementary and high schools, but just by glancing at the reporting from our systems, she could see that the middle schools had not gotten the message, and we'll be getting that message again. We also integrate pre, post, and follow-up surveys, so we also know how our learners are doing, and we can measure longitudinal behavior change, attitude change, skill differentials over time. We issue certificates to users so that it's easy to know who's completed the training. We have completion reminders, and our simulations are built so that you can actually take a break if you're in an hour-long simulation and you can only do 10 minutes, or the phone rings, or you have to go somewhere. The system remembers where you are, and if you've forgotten to complete, it will send you an automatic completion reminder. Also templates for outreach and discussion guides, but I'll talk, I guess, a little bit more about that later. Let's go to the next slide. So for PK through 12 audiences, and we we work in, as you saw from the other slide, we work in higher ed, we work in government, we work with veterans. But in K-12, PK-12, we have several programs. The most relevant to our discussion today is the first one. It's a 3-simulation series called At Risk. There's a version for elementary, middle, and high school, and I will walk you through what the content of that looks like in a minute. Each one of those takes about an hour. In addition, there's a simulation for professional development called Step and Speak Up. What's relevant about that, it's about LGBTQ anti-bullying. It also has suicide prevention content, and one of the aspects of the law is around special populations that are especially vulnerable. And we know from the recent CDC report what we've actually known for a long time, which is LGBTQ students are at much greater risk for mental health issues and for suicidal ideation. The third one there is around supporting military children. The fourth one is really for social workers and school nurses around screening and brief intervention for substance abuse. We do know that a lot of suicide attempts and completions are accompanied by the use of alcohol or other drugs. So, and then the last one is our one and only student curriculum module, which is called Friend to Friend, and has also mental health and suicide prevention content, and comes complete with a lesson plan so that it can be slotted into a health class, it can be slotted in as an advisory activity or club activity. Next. Okay, so, but the real meat here for suicide prevention are these 3 simulations for high school, middle school, and elementary school educators under the at-risk. You will see that each one of them has several role play conversations so that you build your skills by actually talking to a virtual student, or in the case of elementary, also a virtual parent. In high school, you have 3 students. You have one who's highly anxious about her grades and is rumored to be cutting. I think we see from what I've read about the students in Palo Alto, this is a very common student. They're in the pressure cooker, and that's really Renee, who's that young woman on the left. The second is a boy who has poor attendance, low motivation, and drug use. And Rob has had outbursts in class, and you need to be able to talk with him to see what's going on and to see how you can also help him get better attendance and do better in your class. And third, you have Joey. Joey is a shy boy who's written about suicide in an essay, and again represents one of these vulnerable populations. Joey's father has died by suicide, and we know from research that puts him at risk, at higher risk for suicide. In middle school, we have a pair of conversations around girls who have been involved with social isolation and bullying. You see them in the middle there, Mariah and Jen, and Michael on the right-hand side, who has also been writing about suicide. He's losing a favorite relative. And on the bottom, we have 2 conversations. The innovation here is really the conversation with the parent. We've had great feedback. This is the newest of the 3 simulations. It was released in 2015, and is the conversation with the parent has really been a revelation for teachers. So how does this map to AB2246? Well, as you've seen, it's tailored by grade level. So if you're focused on grade 7 to 12, you have those high school and middle school modules that are tailored by grade level. It focuses along the lines of the wording of the law by identifying students in distress and connecting them with support, and avoiding implying that the teacher or staff person should take on the role of diagnosing or providing any kind of therapy. So other states I mentioned have similar legislation, and our simulations are helping satisfy legislation in states like Texas, Nebraska, Arkansas, and Pennsylvania, as well as a few others. In addition, the high school simulation is listed in the National Registry of Evidence-Based Programs and Practices. Middle and elementary have been accepted for review in that registry. So that's something that a lot of folks really care about and is sometimes written into the legislation. Yours is more flexible, and it really follows the best practice for staff training recommendations of Scott Poland, who is a well-regarded authority on suicide prevention in schools and one of the co-authors of Suicide in Schools, which is a great book, and it's I have a link to it in the last slide in this deck. Scott also works with Brenda and the folks at Palo Alto. So let's jump into the simulation and see what it looks like. The first thing I want to do is show you a little bit about the introduction. This is the high school program, and just show you how we frame this issue for the learner. Yeah, there you go.
Hi, I'm Jackie Torres. I'll be your trainer today as you take this program to gain greater skills in identifying, approaching, and referring students who are at risk for psychological distress. Now, what does that mean, psychological distress? Well, it could just mean a student is going through a rough time, that things at home or in their social life are causing them pain. Or it could mean the student is starting to show signs of a mental disorder, like anxiety, depression, disruptive disorders, and substance abuse. I know you're an educator, not a counselor or a psychologist. I don't expect you to diagnose students or help them work through their issues. What we will talk about today is how to notice worrisome behavior, talk to students about it, and connect them with your school counselor. Because let's face it, you're on the front lines. You and teachers like you know our students better than anyone else. So you're in a great position to connect students who need attention with the counselor who is here to give that attention. Now before...
Okay, so that's Jackie and Jackie's introduction for the learner. So clearly she's acknowledging who you are as a learner and what are the limitations. So we really want you to be the eyes and ears of mental health professionals, of the school social worker, guidance counselor, school psychologist, or administrator. And in your policies, you'll develop that tiered approach that Brenda was talking about originally. But here your job is not diagnosing, it's noticing, which is a great skill to have no matter what you're doing. Now, there are other parts of this. As I mentioned, this is an hour-long program with 3 conversations, and I just want to plunk you right down in the middle of things and look at one of those 3 conversations. So you see here, you're going to take on the role of Sean Lyons. You see him from the back. He's a high school English teacher who's one of the yearbook advisors, and he's talking to Renee, the student that we mentioned who's rumored to be cutting. And he's asked Renee to come to his class prior to track practice. So it's after school, they have a little time. You can see that they're sitting at the same level, eye to eye, in order to have this conversation. So we're already modeling some best practices for you. Now, on the left-hand side of your screen, you see how you're going to conduct this interview or this conversation with Renee. You have topics that you can choose from. You can choose to make small talk, and you've got a couple options there. How was the track meet, or how's your family? Or, because we know you might be short of time, you can just jump in and express your concern. I've been concerned about you lately. You seem stressed, or you seem really nervous lately. So Renee is an emotionally responsive virtual human, and she will respond like a real person when you talk with her. So let's make a choice here. Let's look at express concern. You're a busy guy, and let's choose the bottom one. You seem really nervous lately.
You seem really nervous lately.
No, I don't. I mean, what are you talking about?
Okay, so she seemed nervous. when he mentioned that she seemed nervous, and her voice, her face, her shoulders all gave you some pretty visceral feedback that that was not a way to engage her or open her up. She became very defensive. And you can see at the bottom your advice from your coach that this is a broad criticism that's likely to make her defensive, and a better approach could be to gently express your concern or to talk about specific behaviors. Now you can see on the left-hand side of your screen that your choices have now changed. And if you're a player of video games, you know that once you've gone down the path, you're going to have another set of decisions to make. So you could, as Jackie suggests, ask her about her grades or the yearbook or cutting. And the beautiful thing in this system is you also have the opportunity to undo your choice and try something else. That might have seemed like a very reasonable choice, but let's undo it and just take a look at at how Renee reacts to a different way of expressing concern.
I've been concerned about you lately. You seem a little stressed.
Oh, I don't know, maybe. Why?
Okay, so a much better start off with Renee. She's calm, she's thoughtful, she's thinking about what you said, she's not defensive, and Jackie's feedback reflects that. She says, good, expressing concern is a great place to start. Next, explain what's been noticed to cause this concern. Now, within this system, we've not only endowed Renee with memory, emotion, and personality, but we're integrating the techniques of motivational interviewing. Motivational interviewing is started in the clinical world as a way of getting people to tap their intrinsic motivation to make changes in behavior, initially specifically around the use of alcohol, but has more recently been used clinically and extra-clinically, or out in the real world, to help people get inside their own motivations and make changes in their lives. So the change that we want to see Renee make is, well, first we want to find out, and by asking open-ended questions, reflecting statements, and summarizing statements, what's really going on with Renee, and what level of concern do we need to have? These conversations, and remember there are 3 of them in this simulation, are scaffolded to become more difficult as you go along. The one with Renee is less difficult, for example, than the one with Joey, who's very, very reticent and hard to talk with. So let's go back to our PowerPoint and talk a little bit about Palo Alto's experience so far with these simulations. They really, now Brenda, you're going to have to help me. We started working with Palo Alto district-wide in the fall, but there had been an earlier implementation with a smaller group of people, and maybe you can talk about a little bit, before we talk about the results, about your choice to use Kognito and the run-up to doing a district-wide implementation.
Sure, happy to do that. So as Jennifer mentioned, we first started using Kognito as part of an online safe and welcoming schools module that we had created for staff, and that was about 1.5 years ago. We really saw that many of our teachers were wanting to have more information about mental health and how to recognize signs of stress and distress in students. And so we had created this module that was really around wellness and embedded Kognito as part of that professional development opportunity. And we've offered that module 4 times in the last 1.5 years and had about 101 people that have completed the module. And we received really positive feedback around Kognito at that point when we were sort of using it within that module. People were saying things like, I really want to spend more time with that tool. They were talking about Kognito as a powerful learning tool. One teacher even said, it blew my mind how powerful it was just in terms of helping me to be a better teacher and to all of my students. So we received very overwhelming positive feedback about the importance of Kognito. And so around that same time, we were also planning, working on our LCAP, and also doing some planning just in terms of professional development. And so we were looking for some things in particular. I mentioned earlier that we were looking for a tool that could help our schools pre-K-12. Previously, we had been using QPR as a training tool to raise awareness in our district. It's a great tool as well. One of the drawbacks that we were finding is that, number one, we had been offering that training via our board policies. It actually required training every other year for teachers, and so they needed something different. We also wanted to start doing work at our elementary and middle schools, and again, we're looking for a tool that could help us with that. That idea of building common language and a common awareness across our unified school district. So when it came time to thinking about next steps, we, based on the feedback, decided that we would move forward with Kognito as our primary tool. I would say that we were strategic in how we thought about rolling this out, because we knew that there were various stakeholders that were important to include in the conversation, including our board, our school board, as well as our principals, our principals across the school district. So we did share, we actually took time out of we have principal meetings. We took an hour out of our principal meeting and had the principals actually go through Kognito first. We shared the feedback that we had received with them from the 100 teachers who had already participated. And we really asked them if they thought this could be a tool that they would help us to implement at the school sites. And overwhelmingly, our principals felt that it was appropriate, that it was that it had the right approach, and they really supported the effort. And so we did also share it with our board members and said, this is something that we want to roll out, and they had the opportunity to participate as well. So there was a lot of buy-in that happened. We didn't just sort of, move from using it in our module to district-wide rollout. But again, given the context in which we operate here in this district, the mental health of our students is primary. So we saw this as a really valuable tool. And we've been partnering with Kognito to roll this out district-wide since fall. I think Jennifer already mentioned we need to circle back with our middle schools to make sure that we don't miss them. But overwhelmingly, whether we're talking to whether I've spoken to our elementary principals or high school, they have nothing but positives to say about Kognito. So to date, we've had about 542 participants across all school levels who have participated in Kognito. You can see that overwhelmingly our participants would recommend Kognito to a colleague. And again, when you look at teachers who are reporting that they found this value to some extent or to a very great extent, that over 90% found it useful, found it likely to help them, and thought that it was relevant and would help them to get timely support for our students. So I think the data sort of speaks for itself in terms of the outcomes. And I have to say, in terms of the rollout, because we took time to make sure that we had that buy-in, it's been a fairly smooth rollout overall, and I expect that we'll continue to use Kognito moving forward as our primary tool.
Yeah, I want to stress that, just underline what you said, Brenda, because we work with so many districts and so many states that I think that getting that buy-in for anybody who's considering using this tool is really important. You cannot impose things on your stakeholders, on your principals. There's so giving people a taste of what this is, and then, it's a really easy ask, really, once you get into the it of it. So, but I think taking that time to gather feedback and introduce this tool, which is unlike any other professional development tool. So it does bear some explaining, I have to say. Okay, so let's look. So we, the data here comes from Brenda's exit surveys for the high school teachers, and one of my favorite things to do is to look at what people say about their experience with the simulation, because so much of it is overwhelmingly positive, and I like to share these with our team here because they're the people who are building these tools. But I'll just go ahead and read you some of these comments that came through in the surveys. One person said, I participated in the earlier training. This one was so much better. Being able to run the dialogue and then get immediate feedback was really helpful. I saw where I could make better choices in working with students who may need or should most definitely speak to a counselor. And that, again, is scaffolded. You know, each one of those students, you're looking for a different outcome. Someone else said, I thought the scenarios and ways in which the student responded were very realistic. You know, contextualized learning and realism is really one of the things that makes this so sticky and makes it work. Somebody else said, I liked reminders of what not to say, some of which I have said. We all have been there, and it's one of the reasons why we really like for school districts to roll these things out early in the year to really set a tone. It's so easy to fall into habits. I like the opportunity to practice. You know, that's how you build skills. And you have to have that repeated practice in doing the right thing and building it and making it ingrained. And last, we have, it was not the typical training with questions that you get right or wrong. It felt really nice that when I got one wrong, it wasn't a big X and wrong. It was something I want to model for my students. Focus on what you do know. And I think that's one of the reasons that teachers really appreciate this tool. It's very thoughtfully constructed. It is a teacher in and of itself. So it's always an honor to get that kind of feedback from people who think about teaching every day. We mentioned a lot of this already. I'll just talk about it quickly. We do try to make this as turnkey as possible. For districts, each district gets an account manager that helps them with planning and rollout support. Brenda knows this because the person driving the program in Palo Alto was just on the phone with my account manager today, doing some more planning. We do user tracking. We do that at the district level, at the school level, and at the individual level. So again, if you're at a district and you want to see which of your schools has implemented with Fidelity, you can look at that. If you're at the school level and you want to see which of your teachers or staff people have participated, you get that as a monthly report. The survey data is pre-post and 3-month follow-up. You are welcome to customize these tools. There's a small charge for that. But, you know, if there are things that you're particularly looking for in terms of outcomes that we're not picking up, we do have a validated scale that's embedded within this. It's the Gatekeeper Behavior Scale. But anything you want to ask, it's up to you. Local resources is really an interesting little button inside the simulations, which you can provide us with your local resources, and those local resources will be made available then to the learner. So that might be county level resources, for example. A discussion guide. So one of the things that was on, we did this similar webinar on Monday with Mike Lombardo from Placer County, and the comments that we used, which came from a different cohort of learners, said, I really like that this changed the conversation in the school about our students. And the discussion guide is really meant to support that kind of conversation within the school. We recommend that you debrief your teachers after they've had the chance to take the simulation. It's a great opportunity to present and discuss the policies and procedures, but also you know, what's happening locally, who is your referral person, and you know, what's the situation on the ground. I talked already about completion reminders. We don't want anybody to start and not finish. Certificates of completion can demonstrate that completion as well as the reports. The implementation guide gives you like quick tips on where do I put this. and Brenda mentioned that, maybe she didn't, she mentioned earlier to me, they had a few different ways of implementing. Some did it as an in-service where everybody learned together, and some people did it on their own at home and completed it that way. And last, we have a wealth of outreach and promotional resources, flyers, slides, trailers. So if you're doing that kind of stakeholder buy-in that Brenda was talking about to your principals or your PTA or your senior leadership within your district, we have those materials that you can customize and you don't have to start from scratch. Here are some resources. Maybe Brenda, you'll say a couple of words about each one of these, and while people are starting to think of questions they want to ask, and I invite everybody to ask questions.
Absolutely. Yeah, these are just some resources that I thought might be helpful. Jennifer mentioned Scott Poland earlier, who is an expert in the area of suicide prevention. So we do use his book, Suicide in Schools, to help guide some of our practices and actually consult with him. He's been down to Palo Alto a number of times. We also have a toolkit, a comprehensive suicide prevention toolkit that was developed that helps guide our school sites when we have a crisis, but also addresses issues of prevention and postvention. So it's a really great resource, and you have a link to that on this slide. We also attached our policies so that you could take a look. I did mention earlier that we are updating our policies, so what is on there probably will be there for another couple of months, and then we'll be adding information on memorializations and anniversaries to our policy. And then Project Safety Net is the community collaborative that I mentioned earlier that basically extends across all of Palo Alto because we know that we can't do this work alone, that it's through the partnerships that we can really make a difference. And so you can learn more about Project Safety Net and our collaborative on that link. And then finally, Unmasked is a film, a beautiful film actually, that was created by some students in the midst of all of the tragedies that we were having. I didn't mention this earlier, but I think it's a nice way to end. You know, student voice and students coming together to support each other is so critical in this important work that we do. And so this is an idea that was created by students, it was developed by students and shared by students, and it's really a message of hope and how to ask for help. So it's a short video, but I would encourage you to take a look at it.
Great, thank you so much. And we do have questions, so let's take a look. One question is about affect, student affect, and I'm not a clinician, but what I understand that to mean is really like a flat affect, which I think if you, and then we'll send, or you can request from us a link to we'll send it? We're going to send you, Maria tells me, a link to the simulations for you to become familiar with them. And you will see that Joey, for example, is a student with low affect. So yes, it does take into account incongruent affect. I have a question about, now this is really interesting, different socioeconomic status, different racial ethnic breakdown of communities. And yeah, when you hear that Palo Alto is doing this and you're in an inner city school, you might think, oh, this can't possibly work in my environment. But we're doing it here in New York City public schools. The DC schools are doing this district-wide in Washington, DC. We have trained over 300,000 educators from Alaska to Florida, and in any kind of context that you can imagine. So one of the ways that we work to develop these simulations is by getting input from teachers, the sample end user across the country in all different contexts and settings. So it appears from our research that it works actually as well in any of those. In fact, we've even written a paper recently about the utilization of the simulations by Native American users and demonstrated that it looks very much like the general population results. And we're proud of that. I have a question about when this will be implemented in schools. It's been implemented in schools starting in 2010 with the high school educator module. In 2012, we introduced the middle school module, and in 2015, the elementary school. So this has been implemented in lots of jurisdictions across the country. In Palo Alto, they started this fall with their district-wide implementation. So I'm not quite sure about that question, and I invite you to email me. My email information will be on the next slide. But what we do generally recommend is doing this as part of orientation early in the year onboarding of teachers. And of course, if you have turnover, the beautiful thing about this system is you can provide it to anybody new in your system or substitutes who come into the system. This one is really for Brenda. Brenda, what are the first steps you recommend when a suicide cluster has been identified at a school?
Wow. I think some of the things that we did that were very helpful were bringing all of your community stakeholders together. In our community, we have folks who offer mental health, substance abuse. We brought together our faith community, our parent communities. So I think getting people together in the same room and talking about how to coordinate your efforts is really important. I can say that our district has made strides in the area of mental health because we've pulled together with others. I also think that partnering with your county public health department would be another recommendation. They have access to a lot of resources and information that can be helpful. They have access to grants, and I think it can help guide next steps. I would say we did contact the Center for Disease Control through our public health department. That is a process that entails a little bit more work and more conversation, but I know that for us, partnering with our public health department afforded us the opportunity to bring these additional resources to Palo Alto. So one of the areas that I think we are really strong is the community partnership. So I would say that would be a great place to start.
And yeah, I can't agree more. We've worked with a few districts where there have been clusters, and you're really hearing from an expert here, and there aren't so many of them around the country. And one of the things that people always say in this field is postvention is prevention. Mm-hmm. So whatever you do to address a suicide when it happens in your community is going to affect whether or not that cluster occurs.
That's right. One other thing I would just mention, Jennifer, to add to that is we also reached out to professionals and experts in the community. We reached out to Rich Lieberman, Scott Poland, and Tracy Cross, other people who are experts. And what we found is that they were more than happy to consult with us. In some cases, they came to our community, but I think sometimes the solutions involve inviting other people to the table. So I just want to acknowledge that we've also gotten a lot of support from people outside of our community.
Yeah, and that's great. And I know a lot of those people, and they're really available and eager to help, and they bring a lot of expertise, especially when you're in a situation where there has been a death and there are a lot of moving parts in your districts. I mean, we did a webinar recently with Scott Poland about postvention, and he was talking about the effects of social media and how it's really turned the normal policies and procedures for addressing a death by suicide on their head, because oftentimes students are learning about it from each other light years ahead of the adults, and getting ahead of that curve is really part of, I think, why people need to put their plans in place.
Mm-hmm. I agree.
So I think we're going to Oh, we do have a, wait, we have a question. Hold on, I have to read the question. Bear with me, everybody, and then I'll let you go. At risk for elementary educators, module and use. Are teachers encouraged to take the training? Oh, are they required or encouraged, Brenda, to take the elementary module in Palo Alto?
We're requiring the training from all teachers pre-K to 12th grade.
Yeah. Okay. And I think that we're pretty much done here, and I want to thank everybody, and I want to thank you, Brenda, for joining us. It's been really, really helpful and informative, and I think really got people thinking. When we asked the question in the beginning of the hour where people were, they are all over the map. They're at the beginning, they're at the middle, and a few have fairly well-developed suicide prevention programs, but I know that once CDE issues its model policy, these conversations are really going to start to take hold in January and February. So we hope we hear from some of you, and we will be very happy to consult with you and provide pricing and proposals and anything that you might want from us if you're considering this as admittedly only one part of the work you're going to be doing in suicide prevention, but it is a piece you could take off your plate so you can focus on the other aspects of suicide prevention in your community. So thank everybody. Thank you all for taking time. Thank you, Brenda, for taking time. And let's get back together in January or February when we will have maybe a chance to crunch your data and present that in a webinar.
That'd be great. Thank you, Jennifer.
Okay, bye now. Bye, everybody.